Okay, good morning, everybody. I think we've got a bunch of people in the room. We have about 60 people who have registered for the webinar. We have about 15 on right now. I'm really excited. I'm going to put up a poll that will give everybody, all the on-time people, something to do. Let's see if I can figure this out. So the first question is to please describe any work you or your organization does at food pantry or food bank sites. You don't have to write 3 paragraphs, just a quick snapshot. And then I am interested in doing PSE work at food pantry or food bank sites in the next 12 months. So as people are rolling on, we'll give everybody a minute to answer these questions. Super helpful for me as I plan the rest of our webinar season with regards to food pantries. This is Adrienne Markworth, by the way. And there's Barbara from the Food Systems Alliance over here. I don't know if we have Alexandra Bush-Kaufman on video or not. I can't quite tell. We're not all going to stay on video. We're just saying hi to you right now. Thank you, everyone, for answering the questions. I can see your responses rolling in. If you're calling in by phone and can't see, the 2 questions are, please describe any work that your organization does at food pantry or food bank sites. And I'm interested in doing PSE work at food pantry or food bank sites in the next 12 months. So I'm going to give this about another 15 seconds and we can definitely reopen this poll at the end for folks that didn't have a chance to answer it. I have a feeling I'm getting some long answers for the first question. Okay, so I'm going to switch over here to the presentation slide. Welcome, everybody, to the webinar. Thank you so much for taking time to join us today. As I've said, my name is Adrienne Markworth, and I'm the Executive Director of Leah's Pantry. I'm pleased to be joined today by Alexandra Bush-Kaufman from the Regional Nutrition Education Center of Excellence, I think I got that right, in Washington State, and with Barbara Hamilton of the San Diego Food Systems Alliance. We're excited to talk about policy systems and environmental change in food pantries, and this will be the first in a series of several webinars this fiscal year. We wanted to all briefly say hello, but we'll be switching off our videos now. Okay, I recognize many of the names of the folks registered for this webinar, but for those of you who are unfamiliar with everything that we do at Leah's Pantry, I will take a minute and just give you some background. We were founded in San Francisco in 2006. We believe that everyone deserves nourishing meals every day. So we have several programs that many of you are familiar with: Food Smarts, EatFresh.org, our Cook It Kit program. You'll see that we've added the Nutrition Pantry program to this slide, and I'll discuss this exciting addition in a minute. We accomplish our mission with 3 strategies. The first thing we do is we work directly with low-income individuals to support sustained healthy behavior changes related to food choices, cooking, and shopping through innovative programs that address client barriers. We primarily use our Food Smarts curriculum, although we have a variety of other programs that meet the unique needs of our clients and partners, like our emerging trauma-informed nutrition education, which has become an overall focus of our organization. Second, we ensure that the right tools exist to make our programs effective. Many of you are familiar with eatfresh.org and our community cook projects. We also develop resources for pantry staff to better meet the needs of immigrant and refugee clients, among other things. Last, the strategy that brings us to this webinar is our work with organizations who serve low-income individuals to build their capacity to integrate effective nutrition support. This work has a lot of variety and includes going on site to different programs to provide curriculum training in a wide variety of settings, providing technical assistance, consulting, and program management, and of course, providing webinars such as this one. As a CDSS SNAP Ed contractor, part of our scope, sounds like I'm having sound issues. Sorry about that, everyone. Is to provide organizations support who work in food pantry settings. This particular topic has undergone expansion within our organization in 2017. We're really excited to announce that this month we completed our merger with our longtime partner, Superfood Drive. They bring to us a program called the Nutrition Pantry Program, which is a PSE framework used in food banking and hunger relief sites. The framework is a process, but there are specific tools which facilitate the work. Our first stop is capturing a baseline assessment of the food pantry site. We've been closely watching the work of the RNECE program, and we're so pleased to see the release of their Healthy Food Pantry Toolkit Assessment this fall. After talking with Alexandra, we thought it would be a terrific opportunity for her to introduce this tool. Can anyone hear me? Oh, okay. Bethany can hear me. Angela can hear me. Thanks, guys. Okay. All right, we're good. I think it might be Barbara. Okay, as many of us know from PSE work, one of the most important components to a successful PSE intervention is finding other partners to support this work. After Alexandra presents her tool, Barbara and I will share a San Diego story of how this assessment, a capacity building grant through the Food Systems Alliance, and the Nutrition Pantry Program framework have begun the work of meaningful and measurable impact at the client level. I know this work is of great interest in California. We recently did a comprehensive scan of the integrated work plans of all counties, and we found that over 50 counties had food pantry work identified in their integrated work plans. We had 23 different counties represented in the registration for this webinar. So we look forward to your questions at the end and the many discussions to continue as this work becomes more organized, more collaborative, and more impactful. If you have a question for one of our speakers on this webinar, no need to wait until the end of the session to ask it. Using the chat feature, please post your question and identify who you would like to answer it. We have a feature on this webinar where we can kick the questions into a question list at the end. So without further ado, I'd like to pass the baton to Alexandra Bush-Kaufman, who will give an overview of her work. But first, for those of you that are always thinking about reporting, I just wanted to let you know that the environmental scan we're talking about today is already on pairs, and this screenshot kind of shows you where it is. So, hi Alexandra, thanks for being here, and I'm going to mute myself.
Great, thank you, Adrienne. I just wanted to say hello and make sure someone could type in the chat box that can hear. I can see Adrienne is typing. Yes, okay, great. All right, so I'm just going to close my video so that it's and Adrian introduced, I work for Washington State University Extension, and most recently have been working with grant money from the Regional Nutrition Education and Obesity Prevention Center of Excellence West, which is a USDA NIFA and FNS joint project. And so the Western Center is housed duly at Colorado State University and WSU. So the work that I'll be talking about today was supported by this grant, and so here's my funding disclosure statement. And I'm going to start, I'm happy to see that the audience represents a lot of public health departments and also community agencies that are really familiar with public health and will be familiar probably with some of the language that I'll be using. So we know that low-income Americans are accessing food banks and food pantries on a more regular basis. And this is evident through research from both Feeding America and also the USDA Food Apps Survey, where 1% of respondents reported using a food assistance agency, which included a hot meal site or a food pantry, at least once per month. And that, based on the 2014 population data, that would be about 40 million people. So the model that you're looking at here is proposed by Karen Blands and her colleagues on the nutrition environment, particularly community nutrition environments and the factors that affect the environment. And the circle identifies where food banks and food pantries fit within this model. And on the right, related to SNAP-Ed PSE interventions, this is a list of the different PSE actions that could apply that would affect either individual variables, the policy variables, or some of the environmental variables listed within this model. So when we started this work in 2005, there was not a scored, validated, and reliable environmental assessment tool, or eScan, that focused specifically on the food assistance setting, or the food pantry setting. So we started off in late 2015. We started down the road to produce the Healthy Food Pantry Assessment Toolkit, and it now includes the assessment tool, which I'll talk about, an instruction guide, a webinar, and a resource guide. So the objectives of this project were to establish best practices for measurement that emergency food assistance programs and community partners like yourselves were undergoing to improve the health of low-income Americans when they access food pantries. And we also wanted to look at the existing research literature, and also we recognized that there was a lot of information, a lot of practice-based information that was going on out there. There are several other states that have toolkits, and people were doing a lot of different things. So it was in many ways surprising to us that there wasn't an assessment tool that had been tested that was ideal for use in this setting. And we knew that there was a need for such a tool. So we cognitively tested and piloted the food pantry eScan. We also went through the literature, and for the resource guide that we made, we matched up existing resources with different sections within the tool. So if you complete the assessment and you're interested in focusing on one area, you can use the resource guide to say, okay, what are some available interventions that are out there? And then I wanted to talk about how we conceptualize measuring the community nutrition environment. So it's a part of the organizational food environment that is outside institutions. So a lot of the evidence comes from food environments like schools, prisons, workplaces, and the community nutrition environment outside of the institution would be the retail setting or a place where people obtain food in exchange for money or something else. In the case of food pantries, we consider that visiting a food bank or a food pantry does cost something, in that there might be an emotional cost or another social kind of cost to going into the food pantry, and that people's behaviors within those environments are comparable to behaviors of consumers in the retail setting. So there's a lot of work already in healthy retail, and we borrowed heavily from the evidence within healthy retail and also institutional healthy schools, or smarter lunchroom interventions when crafting this tool. So I traveled around the summer of 2016 after conducting 41 in-depth interviews in the Western region. And just want you to know that we have visited a lot of pantries and some in California, which I'll talk about later. And when we talk about how we evaluated this tool, these are the terms that we use to talk about the evaluation of the assessment tool and the toolkit itself. We tested it for inter-rater reliability, test-retest reliability, face validity, content validity, variance, and utility across populations. So we did not include an evaluation of food pantry clients, like the individuals that obtain food from pantries, because we wanted to focus just on the environment, like an e-scan would, and not on the consumers or the clients. And because we didn't do client surveys or diet recalls, we don't have construct validity. And this field, while it has been going on for about the past 15 years related to healthy retail, which is quite diverse in its evidence, with food pantries, this is all still kind of very new, and there is no gold standard for food pantries. There is no one way to do healthy food pantries or food banking, because each food assistance environment is unique. The volunteers, the agency, the setting that makes up that environment is also unique. And so because there's not a single gold standard, there's nothing to compare that to, which is why at this time, criteria and validity cannot be determined. And so when you're using the Healthy Food Pantry Assessment tool, it's important, because of these limitations, to note that each pantry score cannot be compared to other pantries in other areas, that the pantry score is best used when it is compared to itself and how it changes along the continuum. So we did pilot tests in 5 states, Oregon, California, Nevada, Colorado, and Wyoming. And then we did a field test for reliability in Washington, California, Maryland, Delaware, New Hampshire, Montana, and New Mexico. And here what I'm showing are the ranges. Oh, sorry. These are the ranges and the averages of the different scores for the Healthy Food Pantry Assessment tool completed by outsiders. So when we tested inter-rater reliability, we had a community partner, which many of you probably represent community partner agencies. And then we also had an insider, and that was a food pantry manager or lead volunteer who was more familiar with that setting. And we had them complete the assessment separately, but at the same time, and then meet again 7 to 14 days later to complete the assessment again. And there are 6 sections within the tool. The first 5 are scored. Section A is location and entrance. Section B, foods available to clients. Section C, policies of the food pantry. Section D, food storage and food safety, and Section E, client services. And what I'm showing up at the top here are the points possible within each section. And we arbitrarily set it to 100 because we thought that that was an easy reference point for a lot of people. And we weighted foods available to clients with the most points because we heard when we did the interviews, and also in the research literature and other evidence that when you make healthy foods available, that people are more likely to select those foods. And what we heard in the interviews and the way that we assigned points within this tool is that Section B, food available to clients, includes fresh food, frozen food, canned food, and dried food. So it's multiple different types of food, not just focusing only on fresh, because pantries traditionally had relied on shelf-stable items. So we did the assessment in a wide range of areas, and the pilot test also included cognitive testing, where we wanted to make sure, again, of the content validity. You know, are these the appropriate questions to be asking if we're attempting to measure these things? And our reliability statistics, which are being written about in a paper that is going to be submitted to a peer-reviewed journal, our correlations were very high. So our retest reliability was very good, and so was our inter-rater reliability. And I wanted to show you here the distribution of scores. The light green are outsider scores, which would be the outsider agencies that you might represent if you're in public health, if you're working with SNAP-Ed funding. And then the blue scores are insiders. So it follows a nice little bell curve here, and for the most part, the insider and outsider score comparatively across the different types of pantries that they were looking at. So which is a really good thing for the tool, so you can feel good about using it, because we feel that it has strong reliability and good face validity and content validity. So how much you use this? There are 3 metrics that you can use it to report with SNAP-Ed that FNS has identified as a priority. That would be ST5, ST7, and MT5. And ST7 and MT5 are the priority indicators. And here's some examples of how you might be using it to measure systems changes within MT5. So you might be asking, okay, well, how do we use this tool? So the tool is meant to be used by, there are 2 users that it was tested with. It was tested with food pantry leaders, which might be a volunteer position, or in some cases it could be paid, and also community partners, primarily represented by FNEP or SNAP-Ed program funding. That isn't like restricted to just SNAP-Ed or FNEP program people, but those are the community partners that tested it in our setting. And the toolkit is available now. It includes the assessment tool, an instruction guide, a resource guide, where each question is matched with at least 1 resource if it's available. And also there's a webinar training on how to use the tool. And I would be happy to answer any questions you have specifically about the assessment or the testing process. And we do have at least 2 manuscripts that we're working on to submit to peer-reviewed journals about this work, and filling this gap and this need for evaluation tools to demonstrate positive change in healthy environment interventions. So thank you.
Great, thank you, Alexandra. Next, introduce Barbara Hamilton from the San Diego Food Systems Alliance. The Food Systems Alliance is very close to my heart as an organization. We've been a member since the beginning, and we also serve as the fiscal sponsor. Their work, I can say, is incredibly collaborative, and they've developed a tremendous gift of getting the right folks at the table at the right time. So collaborating with them in this space is a little bit of a dream come true. I'm going to put a quick poll up right now while we get Barbara situated. And this is going to be more specifically related to, oops, wrong poll. This poll is going to be more related to how capacity building work at the food pantry might happen in your geography. So the first question is, what are the capacity building needs, such as cold storage or transportation, in order for you or your food pantry partners to distribute more fresh produce? And then second, does your county receive support or education from your local government regarding food waste reduction and donation? So if you can just take a minute and quickly answer these questions. I'm going to pass it over to Barbara. Hopefully everybody can hear me. It looks like you guys are answering the poll. Okay, looks like we do have people that are getting some information from their local governments. Can I just ask someone to confirm that someone can hear me? Okay. Barbara, I am trying to turn your microphone on, but you may want to try it from your laptop. It doesn't seem to want to let me turn your microphone on from your cell phone. Like it would let me do it otherwise. So do you want to try and just use your microphone on your laptop right now and see if that works? Okay. So looking like we are getting a lot of waste reduction at the government level. At least 4 of us, or 6 of us, I guess, are getting at least support and information. I'm going to see if Barbara can join here. Uh-oh, she's having technical difficulties. Well, I'm wondering if it makes sense for me to try and run through this information. So the Food Systems Alliance, as I mentioned, is a collaborative project in San Diego, which has a whole bunch of different stakeholders that come to the table. They have different food access, they have different working groups such as food recovery, healthy food access, barriers to farming, fishermen, things like that. The 2 areas that I think are most applicable to this work are the healthy food access group as well as the food recovery group. Barbara was brought on about a year ago to lead the food recovery efforts in San Diego County, largely by partnering with Save the Food San Diego. This has been a really fun campaign to work on. She's been able to get billboards up around San Diego County, really encouraging at the consumer level for us not to be wasting food. She's looking, though, at all of the different levels of source reduction, and as part of this work, She has been looking at the way that food is moved through the hunger relief system, and whether that's from grocers, institutions, prepared food, either through the food bank or relationships brokered by the food bank. I'm back. I'm back. Um, Leah's Pantry is involved in this in order to talk about healthy hunger relief in the food. That's kind of where I have gotten to know Barbara and gotten to this table. She did get the opportunity to provide mini grants to some of our hunger relief partners in San Diego. And so they put out an RFP for a cold storage mini grant. And that was a partnership between the San Diego Food Bank, Feeding San Diego, which is our two food banks, as well as Leah's Pantry, with the partnership of Superfood Drive, which we mentioned earlier. So the grant opportunity was through an anonymous donor, cold storage refrigeration units. We were able to select 5 different food rescue organizations in San Diego County, such as you could be a food pantry or a meal service provider. And then each selected organization was able to receive a 2-door glass front refrigeration unit with 50 cubic feet of capacity. So this was an exciting project. And when I heard about it, I thought, oh gosh, the Superfood Drive team should really make sure its partner pantries were applying. And then in talking with Alexandra, realizing, okay, wait, this is a great collaboration opportunity between kind of a SNAP-Ed PSE intervention and the San Diego Food Systems Alliance, in order to really make this have a lot of impact and be able to demonstrate to the Alliance that this really did have an impact at the client level on the types of foods that were distributed. Obviously, there's balances that need to be made in this type of work when we're talking about waste reduction. We really want to have healthy foods in the food pantries, so we don't want this to be an excuse to sort of kind of dump unhealthy foods into the food pantry system because we're prioritizing waste reduction over the health of our populations. And so there's a lot of really interesting balance that needs to be met there. There's environmental health complications with regards to food safety. Of course, that's always at the table when you're having these conversations. And then legal compliance and reporting with regards to how much food is being wasted. And Barbara can speak like really, really fluently about this at the state level. And it's a total shame that her microphone is not working because she knows about 50 million times as much as I do. I think my interest is looking in the collaboration of the process and how sometimes in SNAP-Ed, we might really want to work in a setting and we might really want to do a PSE, but we really need partners at the table to make sure that that gets done. SNAP-Ed is never going to pay for refrigeration, but SNAP-Ed would love more refrigeration in order to make its PSE work more impactful. And so for Alexandra's team to start giving us tools where we can actually measure that impact, I think is something that is an incredibly exciting opportunity as we move more and more to wanting to measure the impact of our PSEs, going beyond just listing the number of interventions and showing that they're throughout the socioecological model. So I guess I will just jump into my part, which is really to tell the story of one of these pantries. So we gave 5 capacity building grants through this program. I'm just going to give you a quick peek into what's happened so far at one of them. The partner is the Community Resource Center in Encinitas. It's dedicated to supporting families and individuals in northern San Diego County. An absolutely terrific 5-star organization. They received the capacity building grant via the Food Systems Alliance, and in the course of those conversations, they agreed to have an assessment and site visit administered by Leah's Pantry as part of the program. So we actually didn't write this in to the original grant, but we snuck it in basically and said, hey, we're so glad that you've been able to get this refrigerator. We'd love to also offer you technical support of the Leah's Pantry team and administering a baseline assessment so that we can really measure the impact that this capacity building has had. So CRC immediately agreed, scheduled a site visit. They already knew about the nutrition pantry program, so they were sort of primed and excited. Our very first visit, we administered the assessment, but that took about 15 minutes. We spent about 45 minutes to an hour learning about their site, taking a tour, building relationships with their staff, really getting a sense of the place and the values that drive the work there. And that was really the most fun part for all of us. We came home with all that information. We came home with a completed assessment, and then the second visit kind of organized all of that information and really put it into the framework of the nutrition pantry program. So talk a little bit about how the assessment works within this framework. The nutrition pantry program is about implementing practical client-centered strategies for a health-focused environment in all types of food distribution sites. Very client-centered work. What we're doing at the pantry level is saying that pantries are aligned with our NPP focus areas, which I'll show you in a minute, and that they're encouraged to grow and improve based on their interests and capacity, not compared to other pantries. So this is to connect what Alexandra was saying about understanding the work and understanding the assessment. It's not a letter grade, it's not pantry A as compared to pantry B, but within the work being done at pantry A, can this assessment help us move in a direction of more healthful foods being distributed? So we use kind of a seed sprout bloom readiness metaphor essentially to look at each framework and each focus area and say, where are we on this path and where do we want to go? So for example, we've got 6 focus areas. I'm not going to go over them now right now. We are going to have an NPP webinar on February 1st. That y'all are welcome to join. It'll be focused for Catholic Charities agencies, but it will be opened up to everybody. But we're looking at 6 focus areas, which are similar to the ones that Alexandra talked about in her slides, slightly expanded perhaps. So we're looking at cultural and dietary accommodations, resources and partnerships, which is obviously a focus of this webinar, inventory and environmental stewardship. So that's what are we providing, and also what kind of environmental stewardship, waste reduction practices are embedded in our work. Looking at nutrition goals and pantry plans. This is not just policy work, but it's also how does the work at the pantry happen and keep happening, and are these things documented? Policies, as we know, can sometimes be written and signed off on and not implemented. So we really want to get deeper than just sort of checking that. We wrote a nutrition policy box. Nutrition education for clients, volunteers, and staff. Is that appropriate? Is that available? And then what is the environment like at this food pantry? So this is nudges, yes, but it's also, are we warmly welcoming our clients into the space? Do we have a trauma-informed way of understanding the stress of hunger relief, and are we dealing with it appropriately? And that's when we start looking at dignity policies, wait times, the way that people are waiting, the way that people are treated. I just want to pop in and focus on 2 things before we wrap up and get time for questions. But when we do our first site visit, you can see that our Healthy Food Pantry assessment is right up here at the top. And in this case, this pantry scored a 62, which when you look at Alexandra's data earlier in this presentation, you can see that scoring right above the mean or median. I think they were pretty close. We felt like this was a terrific pantry. So when we got the score of 62, the first thing I thought was like, oh my gosh, how can I tell them they got a 62? I wanted to give them 100. But then kind of stepping back and realizing, okay, this is not an academic environment. We're all trying to get A's. This is literally just trying to understand what is happening. So I had that score, I had that going with me. It wasn't something I emailed to them. We said, we're going to come back up and meet and talk with you about this and get a full organization and context of your work. So we went over the assessment. She had some questions, and I think this is a learning for us, is as Alexandra was saying, the site staff can administer this assessment. It might have been better for the site staff to administer the assessment because we might have missed something because we don't know the site as well, or maybe both of us could have done it. So we made some notes on that, and then we launched into our focus areas. So I just want to take a close look at one focus area and show you the way that this can work. So for inventory and environmental stewardship, kind of the statement behind this is that healthy foods are prioritized for distribution and pantries support waste reduction efforts. So the first thing we do is we take a look at what's already happening. There was a lot of incredible existing work at this pantry that we really, really wanted to highlight. This is telling a story of a success. This isn't just, okay, what are you doing? Actually, we don't care. We just want to tell you what you need to change. It's sort of the opposite of that. So really saying, let us into your world here. What are you thinking? They have a point system that incentivizes healthier choices. Pantry that groups the healthier foods in one area. There's a ton of fresh rescue, 2 deliveries per day, a lot of produce and healthy foods. It really helps that NCNUS overall is health conscious. They do things like prioritizing reusable bags, so you get extra points for shopping if you bring your own bag. So those are some of the things they're already doing. What do they want to do? What's their wish list? And this is coming from them. This isn't coming from me, the technical assistant provider. I'm happy to offer suggestions, but what I'm really interested in is you guys sit in this area every day. I'm sure you have your own wish list. They really want to find a way not to receive so much bread. And I'm sure those of you that are working in food pantries, that's not news to you. And they're excited about the cold storage unit. They said this new unit's going to allow more prepared foods, which currently they often have to freeze because the supply is uneven, which affects the taste and texture. It will allow produce to be saved. Some of this produce comes in and it needs to be refrigerated immediately. And so this allows that to be refrigerated and put out right away. So we could see in this case that one of these wish list items, we got to figure that one out. And one of these wish list items, because it was paired with capacity building, we were already able to make this happen. So we ended up determining that for this focus area, their current stage was a bloom. They were already really doing what they wanted to do, and the stuff that was on it really. I'm back, trying to keep everybody guessing here. Okay, so my last slide, let me scroll all the way back down, is what is this path to certification? The Nutrition Pantry program does offer a certification, and it's based on how many blooms, how many sprouts, how many seeds. We've identified next steps and goals. So the assessment really is a launching point for us. We'll do the assessment again after 6 months. We expect to see some changes because we're specifically increasing capacity for a variety of fruits and vegetables. We're expecting a lot of other things to happen as well. And really all this was made possible by the collaboration with the Food Systems Alliance and just putting all those pieces together. So that's kind of all I have. We don't have the end of the story. We only have the beginning because we just did these assessments a couple of weeks ago. I'd love to have anybody ask any questions they want and put them in the chat. I think I saw one question, which was, can those getting government support please share the name and where they are located? So that was one of the poll questions before. If you are one of those counties, can you just type into the chat what county you're from? And then anyone else that has any other questions, please type them into the chat and we will answer. All right, I see a couple people typing. What is meant by government support? That's a good question. I think what Barbara means by government support is there currently a waste reduction initiative in your county? Is the government providing, for example, funding for capacity building or increased transportation or funding for trainings, information being distributed or gathered? Is the government at the table supporting these efforts? You know, for example, something we're seeing in San Diego is that San Diego County has a, a big part of our waste reduction efforts, and they are supporting it in various ways and providing a report to the Board of Supervisors, I think, about how all this stuff works. And so there's a lot of buy-in. So is both the NPP assessment tool and also the yes. So Healthy Food Pantry Assessment Tool is on pairs. It's an environmental scan. The Nutrition Pantry program itself is made up of SNAP-Ed allowable interventions. So as a PSE, it's kind of a process for doing that. So most of the things you'll be able to select from pairs in terms of what strategies that you've used. So in that sense, all the stuff that you'll be doing is SNAP-Ed allowable. The Director of Environmental Management here in El Dorado County is a former environmental manager from Orange County and very familiar and with hands-on with Waste Not OC, which is a kind of an amazing program that's gotten a ton of publicity nationwide, which we may try to do small scale here in El Dorado. So it sounds like funding is always an issue, but there are meetings happening. We've already done a survey, which I think is really important. I know a lot of different people just wonder how much food is actually being wasted. I know if you've ever worked in a restaurant, you know that the person that does the buying is not the person that takes the trash out at the end of the day. So sometimes there's a big mismatch between the perception of waste and the actual amount wasted. And I know that that happens in the food pantries as well. People sometimes underestimate how much of the food that goes to food pantries does need to be disposed of because it's not in good enough shape to distribute. Will this webinar record? Yes. So usually what happens is it takes an hour or so for YouTube to be able to process the webinar, but we will put it on our website. So this link right here, leahspantrysf.org, Eat Fresh Webinars, that has the recordings of all of our webinars as well as the mechanism to sign up for any new ones. We'll also add you guys to the eatfresh.org newsletter, so you'd be able to get invitations to the webinars going forward. All right, I don't see anybody else typing. Are there any other questions? Thank you very much, Teresa. We are very happy to be a part of this work and happy to collaborate with so many of you. And once again, really appreciate everybody taking the time with us today. Everyone's emails are right here for easy access. And as always, feel free to reach out to the Leah's Pantry team for any questions you have about any of our programs. Thank you very much for Alexandra for coming all the way from Washington over the internet, and Barbara, so disappointed we had technology problems. She's amazing, doing incredible work, and I hope they didn't butcher her slides too badly. Thanks so much, everybody. Have a great day. Oh, Barbara's internet didn't work. We practiced yesterday. Barbara.